So under Medicaid, it's very different. In the Medicaid scenario, Medicaid has determined what they believe the cost of implementing an EHR. It's a study that they conducted with another organization. They've determined what that is. Based on what they determine, they're going to pay 85%. So the way this works under Medicaid is there are two pieces. One, you have to have 30% of your Medicaid patient volume. 30% of your patient volume has to be Medicaid patients, right? If you're a pediatrician, that bar is lowered to 20%. However, in that case, if you qualify as a pediatrician with the 20%, you also receive less payout. So the question has been raised, if you're a pediatrician and you qualify under 30%, can you qualify under that plan? And the answer is yes, and you could qualify for the higher payout. So that's the first piece, who qualifies. Under Medicaid, that's who qualifies. The way you're paid is, as I said, 85% of what they have determined as cost. And in the case of Medicaid, the great news is you don't actually have to be qualified under year one. You could submit under the Medicaid plan that you have started under the program, that you're using an EMR, and that you are headed towards doing this. And actually, you could receive payment year one. You actually have to have proven meaningful use by year two in Medicaid, which is very different than Medicare. And also for Medicaid, you can wait as long as the year of 2016 to get started and still get all your money. So what would happen is if you waited till 2016, you would start receiving your payments and they would go through the year of 2021. With Medicare, there is nothing paid after 2016. So it's very different plans. How that looks is you choose your year one. So in this case, the year is not defined as 2011, 2012, et Year one is your year one, whatever you choose. Anything between 2011 and 2016. You define your year one. Your payout in this case is $21,250 if you're qualified under the 30%. If you're qualified under 20% as a pediatrician, again, it is reduced and it's $14,167. Year two is your year two. So you'll see the continued payments of $8,500 throughout until your maximum is $63,750. So this is a much better plan. As you can see, it gives much more time to get into the program, more time to qualify, more time for payments, and you don't have to qualify year one. So Medicaid's a much more lucrative plan. However, one thing that I'm not sure if we did address this too much in the slides, but we'll talk about, Medicaid is funded obviously by the states. So, Medicaid is a very different funding plan, and how you receive your money is the similar way as you do to Medicare. However, it's the state funding it. So there's a lot of questions around funding under Medicaid.